Anybody that's ever had to deal with healthcare understands that one of the most expensive parts is not only seeing the doctor and being in the hospital, but it's the follow-up care and the prescriptions that come with it. We have a great opportunity here in America right now under Donald Trump, and he has made it his prerogative to lower healthcare costs and lower prescription costs, especially when it comes to big pharma. In fact, at one point, you even had RFK saying that he was going to remove all of the big pharma commercials on television. That didn't necessarily happen, and this is not necessarily a war against big pharma. Let me say, I think it's good, the technology, the investment they have in science and advancement and finding cures and ways to treat that doesn't have necessarily all of the other, what's the word I want to say, all of the other backlash that comes with some of these other pills. But what we're finding is that the main forms, the brand names, they're tying up these, when it comes time when those patents have run out after 20, 30 years, they've gotten their money. They've been able to work out all their kinks. They've gotten their money from their research. They definitely have been able to buy their Mercedes and enjoy reap the benefits of their investment. But they're tying these generic options up in court. And when you have the majority of prescriptions filled by generics, except for a lot of the very expensive ones for cures of cancers, it's time that we have some legislation that can be proposed that makes it easier for these generics to get, after a certain time limit, makes these generics an option for those folks that, have to pay for their own prescriptions.